Certain foods and drugs do not go together because they reduce the effectiveness of the medication or can cause side effects. Here are 5 foods that could affect your medication. Number 1, grapefruit. This fruit can interfere with a range of medications, including some statins, antihistamines, and antidepressants. It contains compounds that block the enzymes responsible for breaking down certain medications, which can lead to higher levels of the medication in the bloodstream and increase the risk of side effects. Number 2, licorice. It can increase the risk of side effects of some medications, including corticosteroids and certain blood pressure medications. Licorice contains a compound called glycyrrhizin, which can reduce the body's ability to metabolize these medications, leading to higher levels in the bloodstream. Number 3, green leafy vegetables. Vegetables such as spinach and kale are high in vitamin K, which can interfere with blood-thinning medications such as warfarin. These medications work by reducing the body's ability to clot blood, and vitamin K works in the opposite way, promoting clotting. Number 4, cheese. Some types of cheese contain high levels of tyramine, which can interact with certain antidepressants and cause a sudden increase in blood pressure. This interaction is known as the cheese effect and can be potentially life-threatening for some people. Number 5, soy. Soy products such as soy milk and tofu contain compounds called phytoestrogens, which can interfere with certain hormone medications such as birth control pills and hormone replacement therapy. These medications work by altering hormone levels in the body, and the phytoestrogens in soy can impact this balance. Thank you for watching this video. I wish you health and happiness. See you in the next one.